As D.C. prepares to join more than a dozen states that allow the use of medicinal marijuana, some patients say other laws are going to have to change in order for this to work.
Take, for example, drug tests. If medicinal marijuana is legal, how then can an employee deny you a job for taking a drug that is legal? Gary Nuremberg talked to a woman facing that exact problem.
It's been keeping me alive for the last 20 years. The medication along with marijuana.
We'll call this D.C. woman Mary Jane.
Welcome to Joints.
If Mary Jane lived in California instead of D.C., she'd be inundated with television ads seeking her business.
Here are the flowers, of course, representing some of the finest strains in California.
I've been a patient of Candy here for 5 or 6 years now. Well, I've been a patient here for 11 months.
Year and a half, 2 years.
Is traditional Western medicine sometimes not enough? And medical marijuana might be the answer.
It looks like D.C. will be on track to have a well-working medical marijuana law sometime next year.
Half the battle is won.
But for her, not all the battle.
I've been HIV positive for 20 years. I've been denied employment over numerous times due to drug testing, and I just refuse to tell an employer that I'm HIV positive. This is the reason I can't pass the drug test.
And that's not the only problem she sees. What about patients who have convictions for using marijuana before it becomes legal for them to do so? Should that be held against them by employers or potential employers once medicinal marijuana becomes legal? Some interesting questions.
Yeah, but one interesting question, Maryland and Virginia have not legalized it, right? So what happens there?
Maryland last year, the state Senate actually did, but it didn't get to the House in time for adjournment. They're going to try again. Virginia, the people from the Marijuana Policy Project say it's just not on their list.
I can only imagine. Thank you, Gary.